Thank you for inviting us to visit the council. My name is Stacy Rebello. I know a lot of people in this room already. I can see some familiar faces, and I am the Director of Operations for the North End facility. I also have 5 other Marquis facilities in the state. So we're very happy and excited to be part of this community, and we're here to give you an update. We're waiting for Norman, who is en route. He's the CEO of our company, Marquis. And we have been extremely busy in the North End, doing a lot of things inside the building to do with the staffing and resident care and preparing for the transition of operations. As most of you know, we already have purchased the building, which went through a few months ago. But over the last few months, we've been working diligently to kind of, settle all of the transition pieces, make certain that, there's a smooth transition for the folks who are staying there. We do have about 55 residents at the facility now who are staying at the center, and we have about 95 employees out of about 200 that are staying with us. So we have a lot of updates that, we're here to answer your questions, but we have a medical staff, we have an administrator, we have pulled together a really dynamic leadership team in the facility. I'll still be working very closely with the facility for the next, for the foreseeable future. And, we can answer any questions about where we are with that. I have with me tonight Jennifer Raymond. She's the director of our network development for the company. She's been very involved.
A little bit of collateral so you guys can get a sneak peek of what the North End will look like once we do some renovations. I just want to let you know that Partners is going to be keeping their phone number. So when I give you these, this number is in existence until October 28th, and then it will be changing, and we'll update you guys at the next meeting with our new number. But I just wanted to let you guys know before I pass.
Michael Spearin also is here with us tonight. He's the Director of Business Development and Marketing for Marquis. He's actually the Vice President of that. So lots and lots to tell you. I'm not quite certain, if we want to, really take questions and see what your questions might be. I know you've probably read a lot about what's happening. We've hosted a number of events. We've been pretty visible in the community. The families in the facility know me. I know all of them. I know the residents. And we've been really working closely with the folks from Partners for a smooth transition. That's our goal. So that at midnight on October 28th, if all goes as planned, nobody will really miss a beat, and no one would even know that something changed, that we changed hands. So there he is. So I just started with the intros, giving everybody a little update on what's happening. But Norman has arrived. Norman Roque, our CEO for Marquis, and I'm certain that he needs to say a couple of words.
John, good. I'd like to say too, thank you for doing this, of course. We obviously are glad to see you taking over, as well as I know you've been pretty active in the community, giving back already, so we're certainly grateful for that. So, and thank you as well for making the trip.
Great, thank you. Apologies for being a few minutes late. Parking, as you know, the North End is not easy. And I always like making a splash, with that late entrance. So, seeing you. First of all, thank you all for inviting us. And I apologize, John and I have been going back and forth probably for 3 months. So apologies for taking this long to getting out here. But looking into the crowd, I think I've met quite a few of the folks who are here tonight, and we are wicked excited, as you guys say up here, to be in the North End, and welcomed in the North End with the open arms. It's been an amazing last few months, getting to know the community, getting to know the culture of the community, getting to know the community's needs, and more so importantly, getting to know the facility. So a little bit of background of Marquis and who we are and what we're about, and tell you what we have in plans for the facility. And by all means, we'll open up the floor to any questions you guys may have. So Marquis was founded in 2011. There are 3 partners in the company, myself and 2 other partners. One of my partners is a 3rd generation nursing home operator. So his family started in the 50s. His grandmother was a cook in a nursing home in Chicago. Ended up, going to a different position as business office manager, and ended up starting the family business out there. So in 2011, myself and my two other partners founded Marquis. The first facility that we ran and operated was in the South Shore. Then it was called Coin Healthcare in Rockland. And my partner's mom was running it out of Chicago, coming in every other month to operate that facility. And since then, we've grown as an organization in the last 7 years from one facility, and now we own and operate 18 facilities. So we have 10 up here in Massachusetts. I always joke I know more about Massachusetts than most of the folks who live here because I'm all over the state. So we have all the way out in Holyoke, Western Mass as we call it. We have 3 in the North Shore. We have in Saugus. We have in Beverly and Danvers. We have in Needham, Lancaster, Webster, and Methuen. I'm sorry. Yes, Methuen. And we have one in Providence. Anyone knows Providence, the Roger Williams Hospital? It's on that campus. We have a facility over there. We have 4 in New Jersey, where our corporate headquarters is out of New Jersey. We have 2 in Pennsylvania and 1 in Baltimore. We do have another corporate headquarters up here in Woburn, where we just came from. And our team up here, as you see Stacy, you see Mike, and you see Jennifer, are all Massachusetts based, so they live up here. I live in Jersey, but I'm up here every week. Try to be hands-on in our facilities, and that's the way we operate. There are many companies out there and different organizations. We pride ourselves in being hands-on. We pride ourselves in being as involved in the day-to-day, oversight, making sure that the quality care, great outcomes, quality customer service is to the best of our capabilities there, day in, day out, 7 days a week, 365 days a year. We've done a pretty good job at it, and that's our intention to keep on going at that. So what attracted us to the North End is, the great community, I'm not just saying because you guys are all here, but, the great history. Meeting some of the folks in the last couple of months, like Francine and Elaine Wilson, and some of the other folks who have been very instrumental in the facility throughout the years, has given us even more insight of how special this personhood is to the community. And again, I myself am a licensed administrator for the last 19 years. As I mentioned, when we first met, my family is not in the healthcare industry, but I chose this because I not only respect people, but I've grown, as a child, growing up with my elderly grandparents, it's something that I always wanted to do. So we look at this North End facility, at the culture and the history behind it, as a great opportunity for us to continue that great work that was done over the years. And again, being involved in such a tight-knit community who are 100% behind the success of the facility, success of ongoing care and ongoing outcomes, and make sure that the facility stays successful and the community stays a big part of the facility is always great because, I always say it's a partnership. It's us, it's the families, it's the physicians, and obviously the patients. So what we have in store for the facility is, as many of you have read and heard, we're going to be putting in a lot of capital improvement of the facility, to the tune of close to $5 million into renovating the facility. So every part of the facility will be renovated, from the ground floor to the first floor, to the second floor, to the third floor. Everything will be totally renovated. So the hallways will be renovated, the patient rooms will be renovated, the bathrooms will be renovated. We're going to be doing over a beautiful therapy gym for the patients who are there. I think it's going to be close to like 3,000 square feet. And the best equipment possible for the patients who are there. So a lot, obviously, we have to go through a process. I know one of the questions I was asked was how long do we think it's going to take from start to finish the renovations? In Massachusetts, there's something called a determination of need. When organizations such as ours want to renovate a facility, they have to get approval from the state first to spend that capital. And then once that's approved, you have to go through a DPH review. And then obviously you have to go for the local permits. So every locality has its own different regulations. So obviously the city is probably different than what we've done, let's just say in in Rockland, or so forth and so on. So, we are eager to start the process, but it is a process. There's a lot of, paperwork that needs to get involved, and approved and all that. The DON process here in Massachusetts has just changed. It's become a much more intense process. We've done at least 6 of them thus far in the last couple of years. But it's become very, regulation was just passed recently, so it's become a much more intense, process. So it's going to take longer than the former process we've done the last couple of years. But, we've hit the ground running already a few months ago to start the ball rolling and get all information, and we've hired consultants to make sure that we get this, done right as quickly as possible. But it's going to be a great facility. It's going to be, I know, I watched the videos of the last couple of meetings, and seeing a smiling crowd, so I'm very excited to be here. But, it's going to be a process. It's going to be a great facility, and I as I mentioned to Francine, I mentioned to many of the folks that I've met, we want to have your feedback. We want to have your involvement. Those who have loved ones there, those who have loved ones in the past, those who've just, as a part of the community, want to see the facility, do well. So we definitely want your feedback. As those of you who have met in the last couple months know, I'm easily accessible. Give out my cell phone numbers by all means. Call, email, text, whatever you prefer. I'm available. So definitely want your feedback, and we are always have an open door and open ear to making this a collaborative approach.
Great, thank you. I will open it up to the council first, and then possibly to those in attendance. But I will say, obviously, as long as we continue this, then we're certainly remain best of friends, because this is a very important facility to us as a community, and I think you know that. And it seems as though you're putting in the motivation that it certainly requires. And I know you've been giving back to certain community groups and others already as part of the Good Neighbor, specifically North End Against Drugs. I know Columbus there as well, so we do appreciate that.
Well, thank you, and welcome to the North End.
Thank you.
Very happy to have you. I guess I'd like to focus on how are you going to be different than partners? Partners, as you know, is no slouch in the healthcare field.
Sure. They
said they couldn't make it work. The revenue stream wasn't there. They had to shut down the nursing home to renovate it. You guys were saying something different. How is this going to work so that we're not in the same situation in 3-4 years that all of a sudden you say, hey, partners is right. we can't make it work. We got to close. We got to do this. We got to do that. What are you going to do differently that makes it work financially?
Sure, great question. So couple of things. Again, I have the highest respect for partners. I mean, it's, you ask anyone, not only in Massachusetts, but in any other state, and I spend a lot of time, as I said, in 5 other states, talk about different hospital systems and health systems. And when I say, we're in Massachusetts, and they say, oh, you're affiliated with partners, everyone has great things to say about partners. So nothing but great things to say about partners. I think the difference between partners and us is partners is a $5 billion company. We're a small family-owned and operated company. Partners, is the entire health spectrum, from hospital to acute care to subacute care. Long-term care was I would say 100, not a 10 of their business. Physicians, ACOs. This is, we only do SNFs. That's all we do. We don't do assisted living. We don't do adult daycare. We only do SNFs. We've been doing this the past 7 years as a company. I've been doing this for 19 years. My partner's family's been doing this for 3 generations. We're also very hands-on. We're in our facilities every single. Again, I'm a partner of the company. I'm in my facilities 4 out of the 5 days a week. I'm up in Massachusetts every week. In other states. I have a overly staffed corporate team support that is in our facilities, making sure that the facilities are successful. It's become, in the 19 years that I've been doing this, I've been doing this longer than I have, and Mike started off, as an activities aide in a nursing home and grew, his roles, over the years. But in the 19 years that I've been doing this, it's become a very different industry. But the basic fundamentals that I always tell my administrators, the basics haven't changed. The basics is giving great care and customer service. And I always said, my dad was in a nursing home for rehab as well, and I knew as a provider what to look out for. The basics haven't changed. So when you have your pulse on what the basics need to be day in, day out, and you're successful. Because at the end of the day, and I'll say this, go on record, I mean, we are a business. We're a business that takes care of people. The best business model is having an internal product. Once you have an internal product, you can have an external product. Once you have a good reputation of good care and good service, that internal product we have can be external. You go out and market to a community, go out market to physicians, go out to market to hospitals. Now partners, was again, I'm not saying they didn't focus on that. Of course they focused on that, but they also had to take different types of patient clientele that that they were right away losing money on. Okay, because people didn't have any payer sources. People because they had to feed from their own system, right? So we focus on the basics, on the great care, on the great service, and we're sure that once we continue that, people will continue. The people who are there long term will continue coming. The people who are there short term for rehab will continue coming, and will be financially successful. We have this model in 18 other facilities, and we're sure we'll be successful here as well.
So it's gonna be same model,
Short term rehab as well as long term rehab. Yeah. And I just want to again, I think most folks know, but the facility right now is licensed for 140 beds. Partners is taking 40 of those licensed beds to the Brighton facility. So we only have the capacity of 100 beds.
and that, I was explaining how you free up space for.
Free up space, and we're going to be making close to, I believe, 50 private rooms. Private suites, actually, we're calling them. Because with right now, I'm sure those of you who've been to the facility, the semi-private rooms are a bit small, on the smaller side. With the fact that they're taking 40 beds with them to Brighton, we're gonna have less, obviously, beds, so we'll have the ability to turn semi-private rooms into private rooms.
What's that gonna do to the breakdown of short-term versus long-term? If you saw the video, one of the big frustrations here, you've got lifetime residents whose parents were on the waiting list for years and years.
Sure.
Couldn't get in.
Sure.
Now you're telling us there's 40 less beds. How many of those are long-term beds, and how much does that affect the ability
Sure.
for residents to be able to get their loved ones in?
Sure. So right now, we're dedicating one floor of 30 beds to subacute and 70 to long-term. And again, I want to make this very clear. Hopefully it won't be, a waiting list, but obviously this waiting list in the North End community comes first. So we welcome you to the community, and then welcome to the community. We want to be a part of the community, so I want to make it very clear. We're going to make it our every effort to make sure that every North End community member that wants to, what they would like to be admitted, both short-term or long-term, gets admitted, and we'll turn heaven and earth to make sure that happens. So again, we're starting off focusing on 30 beds for short-term rehab and 70 beds for long-term, and let's see what happens.
All right, I'll open it up to the audience. If you just mind raising your hand and either standing or at least making sure that you're loud so we can hear it in the room. This is Carrie as well.
Thank you. What's the phase of construction? They're going to be signing up, closing a floor to
Sure.
how's that
Right.
going to work?
So we do our own in-house, construction. We have designers, architects, and then we're working with obviously local architects and local subcontractors as well. But we've been doing this, and we're doing it currently now in Methuen. We're doing it in Providence. We're doing it all over. But we know how to work with the facility staff, the facility nursing staff, maintenance staff, to make it as least cumbersome for the staff and obviously the patients as well. So we're hoping not to have to close down the entire floor. Hoping to be able to take one room, 2 rooms at a time, and not to have to inconvenience obviously the residents or the staff. But it really depends on day one. I'm not talking about day one when we take over October 28th, and again that's the plan. Just I'll discuss that maybe a little more. But day one, when we get the final approvals and permits, how many patients we have in the facility at that point. If we have 100 patients in the facility, it's going to be difficult to take 5 rooms because obviously we don't have the space. But if we have 70 patients and we can take 3 rooms at a time and do that, obviously we'll work with, facility. It really depends on when we get the approvals and all that. But we're not going to be in 3 different places at the same time. We'll focus on floor by floor.
Thank you.
Anyone else?
Just want to go back, I'm sorry, as far as takeover date,
Yeah.
we still aren't 100% clear of when we're taking over. Taking over October 28th. But it all depends on partners' approval from the state, from the Department of Public Health, when they are allowed to move in to Brighton's location. So they are waiting for final approvals. They're aiming for the 28th, but everything's up in the air right now. Sorry.
My aunt was a resident at Spalding, and because of all this confusion, I relocated her. I have a sister, and she shared it, so I relocated her. And my aunt is suffering with dementia. Are you going to have a special unit for dementia patients there, or
So I can,
special care?
right, so I can't tell you have a designated unit. In Massachusetts, you have to have special certification. They did this 2 years ago, a year and a half ago, 2 years ago. Special certification for a certified dementia program. Many of our facilities have dementia residents and we have dementia programs, but not special certification. I think 2 of our facilities up here in Massachusetts have the special certification. Right now, we haven't focused on making a special dementia certification. However, as far as taking, care of dementia patients, that's something we do day in, day out. So absolutely, if you choose to have her come back, we'd love to have her back.
Oh, thank you.
And-
I was nice to say.
Absolutely, absolutely. Open arms. Hi.
As you know, I'm there all
Yes.
day, so I can attest that I see Norman and I see Stacy, they're not even there. But now you're saying the reason we're not transitioning is because partners is not ready?
Well, it's not that the partners are ready. It all depends on, they renovated this building in Brighton. There used to be a nursing home Wingate that we used to own them, and so there were a lot of upgrades that were required by the Department of Public Health. They did a big renovation around there as well. So they got the City of Brighton, gave them the okay to get them the CO, certificate of occupancy. Now they have to wait for the life safety inspectors from the Department of Public Health to go out there and say, that's okay for them to move in. So, it really depends on them. I know we built in Rockland, we built an addition to our building, and, they're very thorough, and rightfully so, they should be thorough. And this is a brand new building, which you think, contractors get it all right and all that, but they had to come back a second time to give us the final approval. So right now, things are up in the air until the Department of Public Health's life safety surveyors walk through the building.
Yeah, I mean, the reason I'm asking is because what I've noticed in like the past month is like a lot of, people that maybe they're going to transition over there. It's like they're more concerned about what they're going to do, how they're going to get there than the care that they're giving the people down there.
Right, so.
I mean, I'm there every day. So
Yeah.
I see a lot of like, they huddle around computers and like
Sure.
over the time. So it's like,
So-
if 4 people are at a computer, that's 4 people off the floor.
Right, and I agree with you.
And this is gonna get you, because I
Sure.
know you know, but it's like, so right now, it's like a lot of, it seems to me there's a lot of confusion, because they don't know what they're gonna do, or like the new procedures are gonna be in Brighton. But-
Sure.
Right, but it is affecting the services down there.
Right.
That's what I noticed. I don't know if anybody else has noticed that.
So just to go back a little bit of history about that, so they are not only transitioning to a new building, but also transitioning to a new computer system, and that's why you see a lot of training. And I'm not the spokesperson for partners.
No, I
You know, it's
understand,
supposed to be Marquis.
and it's not like that, sure.
No, no, no.
I find this crazy, it's like there's 4 people, it's like,
Right.
there's people, there's lights going off, and they're at a computer
Sure.
trying to figure out.
But I'll say this, Stacy and team, and Randy Weber, who's not here, who's our head of HR, have spent exorbitant amount of time in the facility to try to recruit and retain as many of the current staff there as possible. They've done an amazing job. I mean, Stacey's spent more hours in the North End than most of our other facilities in the last couple of months. And we've retained quite a bit of the current staff. Obviously the staff had the choice to either move to Brighton or stick with us in the North End. And we've done as much as we can to educate them on, why they should stay in the North End. And we got great feedback. A lot of them are staying. But a lot of, quite a bit of them are moving to Brighton. So we've done job fairs 4 weekends in a row. I can't say we, Stacy and Randy and some other folks have done this weekend after weekend, the last 4 weekends. Been there Thursday, Friday, Saturday, and Sunday, every single day to recruit new staff as well. So transitions, I'll say this, I've done this the last 17 years, 18 times. Transitions are never easy, not on the staff, not on the patients, on the families, and we try to make it as smooth as possible. I think the fact that we spent, Stacy and the team have spent so much time there, they've got to know the staff have got to know them, they got to know the systems, families have got to know them. So we're gonna continue to make this as seamlessly as possible and you know, as easy as possible on the patients and the families, as well as on the staff.
I can tell you one thing that we've done to help promote that seamless transition. We respect the fact that Partners they're training the staff that are leaving. And we have residents staying, some residents are leaving, and we have staff staying and some are going. So what we've done is we started our training over a few weeks of time. And the staff there have actually come on their own time and done our training so that we would not interrupt, the flow of patient care. And it's going very smoothly, so that when we take over, we expect for everybody to be able to get on the computer, be able to be pretty well versed. We also have, in addition to the 95 incumbent staff, we have about 50 to 60 new hires that we're in the midst of processing and then training those folks, so that when, the transition takes place, whether it's October 28th or the week after or the week after, everyone will sort of be in sync and we'll all be there around the clock for the first week, taking shifts, all of us, to be certain that everybody is comfortable and that we know what the residents' needs are. We've also had electronic transfers of all of the resident files. So we already know we're doing some background work, putting the residents in our computer system so that all of our caregivers will know exactly what their care needs are. So it's working pretty well.
I understand, and that's not that wasn't the concern is the people that are leaving, those are the ones that are really not right now, they're just, because I know when you guys have the job fairs, whatever, they go into the, but these are all the pictures, and like I said, I'm there every day, so I know like who's going and who's going, and it seems everyone that's going to Brighton is more focused on going to Brighton than the giving care right there now. That's what I'm trying to say. I'm not saying like the people that are staying, but it seems like everyone that's going to Brighton is like they're more concerned about getting whatever credentials or whatever to go to Brighton than doing what they're supposed to be doing there now.
We'll talk to George.
No, I mean if you just go on like, go in on casual and you just walk around and you'll see what I'm talking about. Because like I say, I'm there every day, so.
What is going to be your patient to therapist / aide ratio? Not overall employees, because a lot of them are admin, but your aide / therapist ratio of patients.
Well, our units are going to be much smaller, as Norman mentioned. I think we're looking at 29, 31, and a 40-bed larger unit. So we'll operate with the same model that you generally see in the skilled nursing center, but we'll be adding some additional positions. We have respiratory therapists in all of our buildings. One of the things that helps us stand out, you asked that question earlier, is the fact that we have specialty programs in the buildings. And for the North End, we will have cardiopulmonary program with a cardiologist and a pulmonologist. We'll have a stroke recovery program, and we'll have a palliative care program as well. So we will have the model of the director of nurses, the administrator, various department heads, social service, care coordination, the admissions office, all of those customary positions that you see, as well as a unit manager model and a supervisor model. So during the daytime hours, there'll be the unit managers who will have oversight of the individual units, along with staff nurses and nurse aides that will be assigned to each unit. And on the off shifts, we'll have supervisors that will kind of oversee the whole house, similar to the way it is now, as well as the staff nurses and staff nurse aides.
So when all of a sudden, that 3-to-1 ratio, that 2-to-1 ratio, what's the ratio?
I don't have the number at the top of my head. We are staffing now, and Norman mentioned these regulations, is based on the acuity and your patient needs. So it might vary from day to day based on what's happening in the center and what are the patient's needs. Yeah.
I have a couple of questions. Are you guys going to handle trach?
Yes.
So that means respiratory trach?
Sure.
Tube feeding?
Yep.
Yes.
Yep.
My son right now is at Wingate in Reading. He was in Wingate in Brighton, but they closed it. So we had to transfer him to Reading. I always wanted him in the North End, but they never took trades, so I had to go elsewhere. But now, hopefully, he has, he has a brain injury. and he took a stroke. And he's only 33 years old, so I want him close to me. I live in the North End, born and raised.
So like Stacy mentioned, we're gonna have this pulmonary program, and we've already, spoken to pulmonologists that are interested in joining the medical team over there. We're actually gonna be doing, again, obviously permit approval, required, but doing piped in oxygen. So we do, in all of our facilities, we are able to handle or take care of residents with tracheostomies, but having the ability to have piped in oxygen will be even easier for our nurses to be able to take care of
He's
those.
on only 2% off.
Gotcha.
He's on
Gotcha.
verification with the other.
Sure, okay.
But when do you think all this will be done?
Well, we want to make sure the nurses have the proper training. So we don't want to say day one when we move in, to do that, because the last thing we want to do is take care of a patient that we don't feel we're clinically capable of doing. So Stacy and team, we have staff educators on our corporate team, will be working with setting up a clinical fair for our nurses to make sure that the competency is where it needs to be. And so I would say give us at least 60 to 90 days to get our hands wrapped
Yeah,
around.
we'll definitely be assessing the skill set and the training of the nurses and the staff that are there already, and making certain that we're providing that training to our new
We're
hires.
hands-on parents, so I know everything about my son when he's there. Every day, like you said,
Mhm.
you knew everything about your parents, and this is how we are
Sure.
with my son. So we know everything. We're there every day.
We learned how to run the machines on our own too.
So I'd be ecstatic if my son could come to the North
And
End.
so in addition to the training, and we're recruiting for respiratory therapists right now, so that will be a big part of getting that competency with the nursing department up and running. But we also, for day one, actually, we're doing a training next week with our physicians that were coming on board. We will have additional resources in the medical department there than they have had thus far. And one of those coming on board is Dr. Ostro, who's a pulmonologist, who is BI affiliated, but also with Tufts Medical Center, and he'll be coming on, which will be a huge resource as well with the clinical education for the nursing department. We're also bringing on a subacute medical director, in addition to our house medical director, Dr. O'Malley, who's remaining, but Dr. Bennell is coming on board with us as well.
Can I ask one more question? Kind of confusing. Can you go further into why 40 beds are going to Brighton? I don't understand that. Why is the facility losing 40 beds?
Because part of the sale that partners, and Marquis arranged was they wanted to take 40 beds with them. And
Does that mean patients?
40, so every facility in the country has a license to operate X amount of beds, right? So up until now, Spalding had a license to operate 140 beds. So
Okay.
they're taking 40 of those
I see.
paper licensed beds, transferring them to Brighton.
So you can't increase your,
Correct, the maximum I can have is 100 patients in the building.
So
why is that? Why?
Because the state gives a license to operate a facility, and they don't give more than you have on your license. They were able to transfer 40 of those beds to Brighton.
I understand.
So when you mentioned that we're going to expand on Rockland.
Yes.
One of the facilities. If you guys crush it, like,
Give them my number.
We'll just say you really well, and if things are swimming, things are going great. You ever see a day where you'd have the ability to add licenses and therefore add?
Sure, so I'll add one point with the determination of need program, there is the ability to add 12 more beds, okay? So if the need ever arises, and we feel there's a possibility, then we will be able to add 12 more beds at that given time. Right now, it's not in our plans, but if, we would be approved to add 12 more beds.
That'd be the max though.
Yes.
Maybe a couple more questions from the audience when we have Marquis. Bill?
My name is Mr. Pitt. You said you're taking over in October. When will the construction actually start, the renovations, and what do you think? Should be done, ready to start taking people back in?
Sure, so A, we're hoping to take over October 28th. B, as far as the construction starting, it really depends on the approvals from the state and then the city. Realistically speaking, just because I've done this many times, I don't see us starting construction for at least 6 months. once we start the construction, from soup to nuts, and please don't hold me to it, I know I'm doing videotape, but I would say approximately a year, from soup to nuts. But no one's gonna have to move out, which means even the rooms that we renovate, you know, at maximum, a patient will have to be out of their room for a couple days. At maximum, we'll be in a different room, maximum.
And we'll be taking patients right from
Sure.
day one. And we're hoping that folks who are short stay patients, when we take over, whether that day is October 28th or not, we're hoping the folks will want to stay there with us because, as Norman said, we can have up to 100 patients. And so we do know the list of patients of the long-term care folks that are staying, but there's, let's say there's 100 patients there now, they've had less patients. There's, you know, a certain number of short-stay folks, and when we take over, they'll be there as well, so.
So what I asked
Have the
about-
option to go or to stay.
What I asked about, that's gonna start immediately,
The
the trade?
Well, again, what I said earlier, we have to train the staff to make sure they're capable of taking care of those patients. But,
Okay.
so that's why I said, give us 30 to 90 days to make sure we're comfortable and the nurses are
Okay,
comfortable.
yeah, so it's a short,
Yeah,
Oh, yeah.
yeah, for
Yeah.
sure.
all right.
Just one more question. First of all, I want to thank you for being so visible in the neighborhood. I know we've talked since the whole partners leaving issue, and we have you stepped up and helping with a lot of the local charities in North End, just recently Columbus Day and the festivals and the senior program. So thank you for that. The team is great. Do you have, affiliations with other hospitals that are just starting, other than, I know, MGH? You mentioned Tufts, you mentioned BI or Lakeland, maybe.
So our strategy, somebody mentioned a bit earlier, what makes you different. Our strategy is going to be a little bit different as well for the North End than I would say, you know, partners had utilized the North End for. Partners really utilized the North End for their system, right? And they really didn't have a strategy for affiliations with any of the other, especially downtown hospitals. So the pulmonologist that we have brought on is, like I mentioned, BI affiliated, also does weekly sleep lab at Tufts Medical Center, so that brings an additional link to Tufts. We have met with all of the hospital systems, specifically for the North End, and there's a lot of other things that are in the works that we're hoping to have affiliations for the North End with all of the major hospital systems. But as an organization, Marquis is very progressive around our affiliations with, I don't know if anybody's familiar with the terminology around accountable care organizations, ACOs, bundled payments, but these are all initiatives that have come out with healthcare reform. And really trying to minimize and reduce the spending of our Medicare dollars. And we have some very progressive facilities in our portfolio down in New Jersey, but here specifically in New England, 2 of our buildings are affiliated with 4 different ACOs, working with all those transitional care managers. They're invited into our utilization review meetings and really working on our quality measures. You have to have high quality standards, quality measures, star ratings, but your outcomes need to be good. And it's the outcomes and your performance in delivering good quality care that really maintains those relationships. And we have our facility in Briarwood, Needham, affiliated with partners, but also BI as well as Adrius ACO, and I'm missing another. I said partners. And then our facility in Webster Park, BI affiliated, South Shore Hospital affiliated, partners affiliated, as well as Brockton Hospital affiliated. We've also participated in our own, there are different models of bundle payment, but as an initiative to show CMS our ability to provide good quality care at lower cost. Our own Model 3 bundle payment, where it's initiated on on an admission into the skilled nursing environment, and we've been able to see really good results in our bundle payment initiative as well.
One more or two? Anybody has a question? All right, well, I'd like to, Francine Gannon's in the room. You've been instrumental with this and are actively.
Jason even alluded to, they've been tremendous in this neighborhood. They've reached out to all of our community organizations. They've even reached out to the health center so that people from the neighborhood, when we have physicians there, can also them into their facility if need be. So there's really a continuum of care here. So I think they've done, and I applaud Norman and God bless Stacy and Jen and Mike. I mean, they've really been hands-on, and I think we're very fortunate to have them in this community. And I thank you for all that you've done to help us here in the North End. Thank you very, very much.
I have one exciting thing, as Norman can attest to, as he's gone through these acquisition processes within the state. One of our biggest challenges has been when you hear about, managed care and ACOs and preferred provider networks. One of our challenges has been with Blue Cross Blue Shield, actually, where they've actually narrowed their network. And it has been difficult sometimes in certain areas where they already have a number of contracts in certain areas to regain those Blue Cross Blue Shield contracts. But we're happy to announce that the North End will be starting. It's actually our first contract that actually came through, signed and sealed. So we'll be starting on day one with the Blue Cross Blue Shield contract. So I'm excited about that.
Wicked excited.
Wicked excited.
All right, well, thank you again, appreciate it.
Thank you.
Good luck, everybody. Thank you.